This video will demonstrate a dry sterile dressing. Prior to performing the procedure, please follow these steps.
I have my clean gloves in place, and I'm going to take either a disposable pad or a towel, depending on what's available on my unit, and I'm going to place that under the patient. First thing I need to do is remove the previous dressing. I'm going to look at the outside and surrounding area to see if any drainage has soaked through. I'm going to use a universal remover wipe in order to take the tape off. So I would open that up and just carefully place that under the tape until I have all of the tape removed. I'm going to look at the dressing. I am looking for color of drainage, if there is any. I'm looking for amount. I'm looking for consistency. I'm also assessing to see if there is any odor. So I'm done with that. I'll fold it upon itself and I will throw that away. Visually, I'm going to inspect the wound. I see that I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 sutures. Those are all intact. The wound is well approximated. I don't see any, therefore no open areas, etc. I need to measure the wound, but first what I'm going to do is prepare a pack of 4x4s, so when I get to cleansing the wound, I'm able to have those readily accessible. The best way to open a sterile package is to peel off from the top, hold onto the inside contents with the paper and open it up, remembering that the outer inch and the outside wrapping is always considered non-sterile. For measurements of the wound, I also need to open a pack of cotton-tipped applicators, and I could do that the same way by folding over and holding on, thus creating clean and sterile supplies. I will grasp one of the cotton-tipped applicators, and for this wound I'm only going to need to measure length because I don't have any openings, so I have no width and I have no depth. So I'm going to bring the cotton-tipped applicator down and I am going to get the exact length. I have a disposable paper wound measure, and I'm going to place this so that I can see what the exact length in centimeters, and I have 12.3 centimeters in length. I will then dispose of those. Now what I'm going to do is I'm going to cleanse the wound. I can use a little saline bullet. I will open that up. At this point I would have the patient a little bit up on their side if they're able, just to facilitate drainage. I don't have any dirty areas noted on this wound. Normally I would clean from clean to dirty, so I'm just going to go along the outer edge of the wound. And again, I would have the patient on their side, and that would facilitate the draining. It's fine to go ahead and use this whole saline bullet, so I would just go over that wound carefully several times until I've used it all, and then discard that. At this point in time, if the physician has ordered a wound culture, I will get a swab stick and I will open that up. I'm going to have a actual swab stick, and then I have the sterile prep that it goes into. So I will open up that lid, pulling out the sterile cotton tip applicator. I would obtain drainage from whatever site is noted to have drainage, and then I will actually put that down all the way into, there's a special processing gel, and put that in place. I would then need to label this with the patient's sticker if you're at Firelands, otherwise name, date of birth. You're going to put the date, the time, your initials, and the exact site that you got this from. This would then be placed in a double biohazard bag at Firelands and sent to the lab. I now can pat dry the wound. So as I'm picking up the gauze 4x4s, I only want to grab the outer corner so that what I'm touching on the wound is not being touched by me at all. And I'm just going to pat dry the wound. In this case, from top to bottom, since I don't have any dirty areas. I can repeat that with both of my 4x4s, and certainly more if needed. So at this point, I am going to take my former gloves off, perform hand hygiene, grab a new set of clean gloves, and I'm going to open my Sterile Supplies. If appropriate for the wound, I may need to use sterile gloves. It will depend on the wound and what's going on and what the physician's order is. So I have another pack of 4x4s that I'm going to open, just the way I did before. And I'm now ready to cover the wound. I am going to place some skin prep around the edges. You can do this either before or after placing the gauze. The important thing with wound care is we don't want to place the skin prep anywhere close to the wound. So placing it after you put the gauze on is also appropriate. Again, I'm going to just touch the corners, not touching where the gauze is going to cover the wound. Just very gently put that into place. And the same with the second piece, using more if needed. And I'm going to tape the edges like a window frame or picture frame. I don't want to use any more tape than absolutely necessary. I don't want to damage the patient's skin. Pushing down on the wound bed itself. The last step that I need to do is to, on a separate piece of tape, I need to write the date, the time, and my initials so that the next person coming in will know how long it's been since the dressing was changed. And I'm going to place this piece of tape over a piece of tape I already have on there, not on the wound itself. Dressing should be checked at least every 8 hours and changed according to physician's orders or if more drainage exists.
Following the procedure, please follow these steps.